In this presentation, I'm going to talk to you about osteoarthritis of the hand and the fingers. One of the most common areas to suffer with osteoarthritis within the whole of the human body is actually to the area of the thumb. It's a bit more complex than that because it is known as the ccarpometacarpal joint. And if you think of the name, okay, carpal bones, there are 8, and then it articulates with the metatarsals, which there are 5, so it's known as the carpometacarpal joint. Now, if I show you in this hand just to start with, so this is the left hand, and this is the pollex side, which relates to the thumb, and then the thumb metacarpal here articulates with this bone, which is called the trapezium. So this would be known as the carpometacarpal joint, and this would be what we call the saddle joint. I'm an osteopath, and I always say to my students, be careful using your thumbs too much when you're doing, say, trigger pointing, your massage, because if you use your thumbs too much, you might find over time the joint deteriorates and degenerates. It's not true to say that for everybody, but I always say to my newly qualified students, just be careful using your thumbs too much, because once your thumbs start to wear down, osteoarthritis is a wear and tear type of pathology, and you might find that once the hyaline cartilage is starting to decrease, then obviously joint changes tend to appear. Now, if I look at this one here, then you can see that we have got the metacarpal for the pollex in here, and you can see that there is the trapezium. And ideally, you can see inside there is nice blue hyaline cartilage that separates the space, if you like, where the joints are located. But you can see here at this CMC joint that there is very obvious degenerative changes. We have got extra bony spurs known as the osteophytes, and that is a typical sign, especially on x-ray, that you might be able to notice that this area has the presentation of these. And also the space is going to appear less on x-ray, and also you might notice the sclerosing, the hardening of the bone adjacent to the arthritis. No doubt it's going to be very painful, very stiff on motion. More than likely not going to be 20 years old, but you could be anywhere from, say, 55, 60 onwards that present with sort of pain. In the morning you might find when you wake up the thumb is stiff, then after a certain amount of time, 15-20 minutes, it feels a little easier, but you might find it can cause a lot of symptoms. So that would be a typical presentation of arthritis to the CMC, which is the carpometacarpal joint in here. Now, if I turn the hand over, then a lot of people can have like nodes on the end of the fingers. So if you're looking at the fingers in here, so this area, so this would be known as what we call the dip. So this is the distal interphalangeal joint, and then this would be known as the proximal interphalangeal joint. And again on this one, okay, you can see that there are a joint here, which is called the dip, and then this one is known as the PIP along here. On this hand, you might notice there is nodules forming on the PIP and nodules forming on the dip. And you can see where the arthritis is located on this particular skeleton. They actually call these, the nodes that are located to the dips are called Heberdin's nodes, and then the ones located on the pips are known as nodes of Bouchard's. Typically present with osteoarthritis, but also they can present with some patients with rheumatoid arthritis as well. But either way, it's a form of arthritic change to the joints, and then you might get these nodes forming, and it's mainly an influx of your osteophytic changes to the actual bone surfaces. So this would be known as Heberdin nodes. These would be known as the Bouchard nodes along here. Again, very painful, very stiff. So there you have a brief introduction on osteoarthritis to the hand, wrist and fingers. Thank you for watching.